Many people who have already suffered a fracture and needed to have plates, screws, or even a metal rod implanted end up with the same question after recovery. Doctor, does this material need to be removed at some point, or can it stay in my body forever? This is an extremely common question in the office, and today I'm going to explain in a simple and direct way when removal of orthopedic hardware is indicated and when it is not necessary. First, it's important to make one thing very clear. In the vast majority of cases, modern orthopedic implants can remain in the body without causing any problems. They are made of materials such as titanium or surgical steel, which are biocompatible, safe, and designed to coexist with the body for many years. In other words, placing a plate or screws does not automatically mean they will need to be removed in the future. However, there are specific situations in which hardware removal is indeed indicated. One of them is when the patient experiences persistent pain or discomfort at the implant site. Some people feel pain with cold weather, discomfort when bearing weight, or when performing physical effort. This can happen, for example, when the plate is very superficial or when the screws end up irritating the surrounding tissues. Another very common situation is hardware prominence. In areas of the body with little muscle coverage, such as the clavicle, wrist, tibia, or ankle, the plate may cause discomfort, become visible under the skin, or interfere with daily activities. In these cases, removal can significantly improve the patient's quality of life. We may also indicate removal when there is tendon irritation or bursitis caused by contact between the implant and nearby structures. This is relatively common in areas such as the ankle, shoulder, or foot and can lead to pain, recurrent inflammation, and limited range of motion. There is also the possibility of late infection. Even after the fracture has already healed, the implant can become a focus of chronic infection, especially if there was a previous infection that was not fully resolved. In these cases, removal of the hardware is essential for proper treatment. In children and adolescents, the approach is usually different. Since bone growth is still ongoing, orthopedic hardware is generally removed after fracture healing to avoid interfering with bone development. Another reason to plan removal is when a new surgery is planned in the same area, such as a joint replacement, an osteotomy, or another future orthopedic procedure. In these situations, removing the previous hardware is part of the surgical planning. There is also the situation in which the patient themselves requests removal after the fracture is fully healed. This can be done as long as it is safe, always carefully weighing the risks and benefits of another surgery. Now, it is just as important to understand when removal is not recommended. If the patient has no pain, no symptoms, no functional limitation, and the implant is well positioned on imaging studies, removal is not mandatory. Every surgery carries risks, including hardware removal. There may be bleeding, infection, tendon or nerve injury, as well as the need for a new recovery period, and, in some cases, even immobilization and physical therapy. For this reason, in orthopedics, we do not remove hardware routinely. The decision is always individualized based on the patient's symptoms, imaging findings, and expectations. In general, hardware removal surgery is a relatively quick procedure and can be performed with local anesthesia or a nerve block, depending on the region. In many cases, the patient is discharged on the same day. Even so, post-operative care and proper rehabilitation are necessary, even when the fracture has already fully healed. Here at UPhysio, for example, we have a specific protocol for patients who have undergone orthopedic hardware removal, with safe, guided exercises adapted to each phase of recovery. If you have plates, screws, or a rod and still have doubts about whether this material needs to be removed, the ideal step is to undergo a specialized evaluation. You can schedule an appointment with me or someone from my team. The link is in the description, along with access to the UPhysio platform. This was the explanation about when and why to remove plates and screws here on Fracture in 5 minutes. In the next episode, we will talk about femur fractures in older adults, a true orthopedic emergency that requires attention and rapid action. Like, comment, and share. Here you understand orthopedics with clarity, precision, and safety.